You brush twice a day, you floss, you use mouthwash, you pop mints before every meeting, and yet it's still there. That smell. Maybe someone told you about it, which is its own kind of nightmare. Or maybe you noticed it yourself, and you thought, okay, it's probably just what I ate. Garlic, coffee, whatever. But here's the thing nobody talks about. For millions of people, bad breath has absolutely nothing to do with food. It's not coming from your mouth at all. It's coming from somewhere much deeper inside your body. And it's been trying to warn you. Today, we're going to find out what it's actually saying. First, let's get one thing straight. Bad breath, or halitosis, affects roughly 1 in 4 people on a regular basis. It's one of the most common reasons people visit the dentist. And yet, most people are too embarrassed to even bring it up. The most common cause is bacteria. Your mouth is home to hundreds of different types of bacteria, and some of them break down food particles and dead cells. And when they do, they release chemicals responsible for that rotten, sulfur-like smell. Poor oral hygiene, dry mouth, smoking, or just not drinking enough water can all make this worse. But here's where it gets interesting. When you've ruled all of that out, when your dental hygiene is genuinely solid, and the smell is still there, that's when your body might be sending you a very different kind of message. And that message is worth listening to. Let's start with the one that lives closest to the surface, literally. Periodontal disease, gum disease. And before you roll your eyes thinking, oh, that's just a dental thing, let me stop you right there. Gum disease is not just a dental problem. It is a full-body inflammatory condition that's been linked to heart disease, diabetes, stroke, and even Alzheimer's. So when your gums are in trouble, your whole body is in trouble. Here's how it connects to bad breath. When you have periodontal infection, bacteria build up in the pockets between your teeth and gums, little spaces that even flossing can't always reach. Those bacteria are constantly producing sulfur gas, and infected gum tissue literally starts to break down. The smell that creates is distinct, kind of metallic, kind of rotten, and it doesn't go away with brushing. Other signs to look for: gums that bleed when you brush, gums that look red or puffy, teeth that feel loose, or gums that seem to be pulling away from your teeth. If any of that sounds familiar, please don't wait. Early-stage gum disease is completely reversible with proper treatment. But once it progresses, you're dealing with potential bone loss, tooth loss, and a chronic infection, feeding inflammation throughout your whole body. A dentist can catch this early, and catching it early is everything. Now we move past the mouth entirely. Your liver is one of the hardest working organs in your body. It filters toxins out of your blood. It processes everything you eat and drink. It manages hundreds of chemical processes every single day. But when the liver starts to fail, whether from alcohol, fatty liver disease, hepatitis, or cirrhosis, it loses its ability to break down certain compounds in your blood. One of the key ones is ammonia. Normally, the liver converts ammonia into urea, which your kidneys then flush out. But a struggling liver can't do that efficiently. So ammonia and other toxins build up in the bloodstream, and eventually, they reach your lungs. When you breathe out, those compounds come with your breath. The result is a very specific smell that doctors actually have a name for: fetor hepaticus. It's been described as musty, sweet, or sometimes almost like a combination of rotten eggs and garlic, even when you haven't eaten either. Other warning signs of liver trouble: unusual fatigue that doesn't go away with rest, yellowing of the skin or eyes, dark-colored urine, abdominal swelling, or pain on the upper right side of your body. If your breath has that musty sweet quality and you're experiencing any of these symptoms, see a doctor soon. Liver disease is highly treatable when caught early. Left alone, it is not. Here's the one that surprises people the most: your kidneys. These two organs sitting in your lower back filter your blood and remove waste through your urine every single day, filtering about 200 liters of blood. But when the kidneys stop doing their job properly, a condition called chronic kidney disease. That waste has nowhere to go. It accumulates in the bloodstream instead. One of the compounds that builds up is urea. And urea, when it reaches high enough concentrations, gets excreted through your breath. Your lungs essentially become a backup filtration system. The resulting smell is very specific. People describe it as fishy, ammonia-like, or sometimes literally like urine. And it doesn't respond to any amount of brushing or mouthwash because it's not coming from your mouth. It's coming from inside you. Other symptoms that often accompany kidney-related bad breath: swelling in your legs, ankles, or feet, fatigue, and difficulty concentrating, changes in how often you urinate, persistent itching, and sometimes nausea. Kidney disease is notoriously called a silent disease because symptoms often don't show up until significant damage has already occurred. A simple blood test can check your kidney function, and catching decline early makes an enormous difference in outcomes. Now, liver and kidney disease are the big ones, but they're not the only conditions that can show up on your breath. Uncontrolled diabetes can produce a fruity or acetone-like smell. This happens because the body starts burning fat for energy instead of glucose, producing compounds called ketones. In severe cases, this can signal a medical emergency. Acid reflux can bring partially digested food and stomach acids back up into your esophagus, creating a sour, pungent breath smell that has nothing to do with what's in your mouth. Sinus infections, tonsillitis, or bronchitis can produce bad breath because of the bacteria and mucus involved. And certain medications, including antihistamines, antidepressants, and blood pressure drugs, can cause severe dry mouth, which is one of the leading contributors to bad breath. The pattern is clear. Bad breath is a symptom, not a condition. And symptoms always have causes. So what should you do with all of this? First, don't panic. The vast majority of bad breath cases are still oral health related and are completely fixable. See your dentist. Brush your tongue, not just your teeth. Stay hydrated. These basics solve the problem for most people. But if you've done all of that and the smell persists, especially if it has that distinct ammonia, musty, or fruity character, take it seriously. Your body doesn't produce symptoms for no reason. It's communicating. Talk to your doctor. Get blood work done. Tell them exactly what you've noticed and for how long, because catching something like early-stage kidney disease or liver stress through a random symptom, like bad breath, before it becomes a crisis, is exactly the kind of thing that changes outcomes. Your breath might be the most honest part of you. Start listening to it.